Hello and welcome to the MIMOSA Matters podcast series. In this series, we will bring you interesting perspectives on the clinical, research, and technological perspectives for near-infrared spectroscopy imaging, or NIRS, and introduce you to MIMOSA Diagnostics. I'm your host, Douglas Queen. Today, we are bringing you a MIMOSA Matters Poster Chat, where you can learn from our collaborators about their important research. Thank you for tuning in and joining us on today's podcast. We will be hearing from Jackie Glenn, the Peak Surgical and Wound Care Director of the Sky Ridge Medical Center in Colorado in the US. Jackie has 16 years of experience as a general surgeon. She specializes in minimally invasive and laparoscopic procedures. Areas of expertise include emergency surgery, trauma surgery, robotic surgery, and wound care with hyperbaric medicine. A veteran of the US Army and former nurse during Desert Storm, Dr. Glenn has also participated in the Afghanistan and Iraqi wars as a general surgeon. While in the Army, she became actively involved in international surgical aid missions in Central and South America. Welcome, Jackie.
Hi, Douglas.
Let me start our conversation by asking you a few questions about your poster entitled Transforming Chronic Wound Healing, Efficacy of Vaporox in Complex Cases, such that our listeners can get some insight into your experience with NIRS imaging.
Sure.
Tell our listeners a little bit about your clinical practice and experience.
Certainly. And thank you for having me. So I have been a trauma surgeon for over 20 years, general surgery, acute surgery, and trauma surgeon. And that has kind of morphed me into the area of wound care. I've started dabbling in the wound care clinic, and I've been fortunate to surround myself with a team that really takes on not only post-trauma patients, but all acute wound care patients. Unbeknownst to me, when I got into this, there is actually a huge science and a lot of advancements in the area of wound care and wound healing. I'm actually now board certified in wound care. Had to take a whole exam and everything, which back in the day when we did normal saline wet to dries didn't exist. So there is a whole science, and it's evolving science, and there's a lot of methodologies that we have to assist our patients in healing. Some of these previously non-healing wounds are actually kind of salvageable.
Great. Give our listeners some background into the study featured in your recent poster at the SAWC Spring Conference.
Certainly. So in the past year or so, my practice was introduced to a new therapy called Vaporox. We have been using ultrasound debridement. The one I particularly used was called a MIST device, but it's using ultrasound-assisted debridement of wounds, which tends to use a relatively painless debridement using ultrasound frequency, stimulates the wound in order to heal. All wounds, when wounds become chronic wounds, they actually need to be re-injured in order to turn around and start healing. And so the ultrasound debridement is a relatively painless way to do that. We've been doing that for years. This device is relatively new, to my understanding. And what it does is it takes the ultrasound debridement technology and pairs it with oxygen. So it delivers localized oxygen to the area that's being debrided. So as it's being debrided, you're delivering extra oxygen, and the intent being to, oxygen helps heal wounds, essentially. And that's the premise behind hyperbaric therapy. So that is kind of the technology that I was introduced to maybe a year or so ago in my practice.
Great. And what was the main driver for the study?
I mean, for the study itself, the fact that I've been using, sorry, I thought you meant for the therapy itself. The driver for the study is because I was introduced to this therapy. I thought, sure, can't hurt, might help, right? You add oxygen to something. Maybe it's voodoo, maybe it's not. I don't know. Let me see. So we introduced it to my practice. We started putting patients on it. It codes out the exact same cost as our regular ultrasound MIST device. It really wasn't there was no cost effect to it to add the oxygen to it. And in fact, it seems that we're actually getting better results with adding the oxygen. And then those, to kind of jump the gun a little bit here, sorry, Doug, but then those clinical results I saw have then subsequently been validated with this MIMOSA device.
Excellent. And what was the outcome of your study?
So this was really just a case series, and we took 4 patients with chronic wounds. And these were all venous insufficiency ulcers. They all had been present for over a year, I think, very, very long time, months at the very least. These were all chronic, failed therapy, failed the standard compression therapy, debridement, all the standard wound therapies. And we added Vaporox. And with the Vaporox, we added the MIMOSA device to measure our oxygen levels. And what we saw was significant clinical improvements, not just in the wound size and the wound healing, but also using the oxygen, the tissue oxygenation measurement device. We were actually able to demonstrate objectively improved tissue oxygenation over the time course with the Vaporox treatments.
Excellent. And what is the key message of the poster that you would share with your clinical colleagues?
I mean, again, this is a case series of 4. I'm certainly not, data you need to apply where it is applicable. I think that given that these are both very new modalities, the Vaporox is relatively new, this imaging modality is relatively new. To me, as a clinician, I've been doing wounds now solidly doing wounds for about 5 years and doing trauma for the last 20. I've not been as excited about a new therapy and a new monitoring device as I have about these in a long time. I really think these are kind of turning the corner into actually objectively saying, hey, here's where we're at oxygenation wise. Let's treat it. Let's see what happens. And I think that just this limited case series, these are the 4 patients that we presented. I have 100 more in my clinic that I can say the same thing for. But I just really think that the case series shows a promise of utilizing data to guide us in our wound therapies and our recommendations for our patients.
Great. So thank you, Jackie.
You're very welcome.
Thank you, Dr. Glenn, for giving our listeners an in-depth insight into NIRS imaging and its utility in clinical practice. Well, that's our podcast for today. We hope you've gained some new perspectives on NIRS imaging and its utility in wound management. Be sure to visit MIMOSA Diagnostics at www.mimosadiagnostics.com. Check out our Learning Plus section, where you will find more information and useful resources. Visit our social media channels. Add your comments and learnings. We want to hear from you.